Hello, my name is Christopher Phillips, and this is my skills demonstration for a simple and uninterrupted suturing technique. The first thing you want to do when the patient presents to the clinic with a laceration that needs to be repaired is to obtain consent. Give them the benefits and the risks of suturing. Some of the risks involve perhaps infection of the local site. And also risks of suturing, because sometimes people would present to the clinic after with a laceration that's 4 days old who want it sutured, and that is contraindicated. So that kind of consent as well. Once you have consent, you want to you want to wash your hands really good, and you want to apply sterile gloves. But before that, you want to irrigate the wound and make sure it's clean. Sometimes if it's in a tender area, it might be a good idea to even numb the laceration with 1% lidocaine, so that the irrigation is actually could be more effective that way and causes less pain. So you want to definitely irrigate with at least 250 mLs of normal saline with a syringe, and make sure it's nice and clean. You want to make sure there's no active bleeding before you do that. If there is any active bleeding, you want to supply direct pressure, which is the best method of stopping bleeding. So once you've gotten consent, you make sure that the wound is not bleeding. You've numbed the laceration with 1% lidocaine, and you have cleaned the site, and also irrigated the wound nice and clean. You have to wash your hands. You put on some sterile gloves and start repairing the laceration. So I have a 4-0 nylon monofilament. This is a non-absorbable suture. It comes in a little package like this. And what you want to do is with your clips, you want to hold on to the suture, to the needle, at the very end, about a 1/4 inch before the end on the flat part. And you want to have it the needle facing up, so that you could twist and rotate your wrist easy. Now, like I said, this wound here, this is the laceration right here. I'm wearing sterile gloves. The wound has been numbed, and it's been irrigated, and we've cleansed the local site. So we want to begin with suturing the center of the laceration to kind of get a well approximation. Then we're going to continue to have it until the entire suture has been repaired. Now for the initial suture, you want to make sure you're at a 90-degree, and you want to be somewhat close to the edge of the laceration, but not too close. And you want to make sure that you are equidistant. There you go, nice and to the one side of the laceration to the other. You don't want to be super far on one end and super close to the other. So you come into the wound with a 90-degree twist, and you actually exit on the other side with a 90-degree as well. And then you pull the suture to the very end. I actually prefer. So what you do is you leave your suture on your needle on not on the skin, but on the actual sterile drape that's on the side. You get the long end of the suture here. You're going to wrap it around the clip twice. Hold on to the end. And since the needle is on this side of the wound, you want to pull towards the opposite end, and just enough pressure to approximate the wound. You don't want to over approximate, and then you want to turn and make sure the knot is on one end. You don't want the knot to be on the center of the laceration. So we're going to go over the opposite end, and just one we're going to go over it, just go over once, since we already have the box knot on the first try. And since we are on this side, now we're going to pull on the other side. And then pull on this side here. And let's go do this one more time. Go over. And then this is the third, go up. And then let's do it again for good measures. And since we're going up, we're going to pull down. Now, once you have a good suture, you want to clip the ends. You want to make sure that the ends are clipped enough, short enough that they don't catch on anything, but also long enough that they don't come undone. So now we have our first suture at the end. We're going to do the second suture, and we're going to have it over here. So again, at a 90 degree here. And then we're going to come out the other end at 90 degrees as well. I pulled a little bit too much off, just pull out here a little bit. Now I'm going to do a box knot again, so it's going to go over twice. Grab the end of the tail and pull up and over, up and over. And we're going to repeat it, going to the opposite end and pull down. And then we're going to go over and up. And then over and down. And then we're going to clip the ends just to make it nice and neat. Another thing you want to do is the little knots, the suture knots. You want to make sure they're on the same side of the laceration down the whole wound. You don't want them in the center, or else they might cause incomplete closures. Now that we've have the laceration on the lower end, we're going to have it again on the upper end here. So again, with a 90 degree insertion site, go in at 90 degrees, put them out at 90 degrees, pull the string all the way through, leave a little bit up at the end. We're going to go over once, twice, get the tail, and now we're going to go up and over. And then now we're going to go over and down. We're going to do this again. Over and up and over and down. And then we're going to clip the end together just like last time. We're going to continue to do this with the very bottom, 90 degrees in, 90 degrees out. Now these are non-absorbable sutures, so the patient needs to come back to the clinic in about 10 days or so to have them removed. So we're going to go up and pull and up, and then we go over just once and then pull down. So we pulled up the last time and then pull up this time, over and up, and then over and down. So in at 90 degrees. Out. 90 degrees. So the first one is always twice. And up. Over. Up. Over. And then over, once over. Oh, I'm pinching the guy. Sorry. And once over and up, and then over and down. And I'm left-handed, so I had to find my own little trick for left-handed people. It seems to be, but I think I got my little groove. And 90 degrees. Out. 90 degrees. Oh shit. And at 90 degrees. Out. 90 degrees. Alright, since we're going to start at the bottom, go over twice. Grab the tail, and go up and over, up and over. And then over once, grab the tail, and down. And over, down, and over. And up and over, up and over. And then down and over. We'll do one more at the end, just to make sure everything looks nice and clean. While you're doing this, to help distract the patient, you could talk to them about educating them on signs of infection, which includes discharge, erythema, warmth. 90 degrees. 90 degrees. Fevers, chills. Um, home care instructions. Soap and water should be fine to keep it clean. Don't go crazy scrubbing it or anything like that. Over twice. And over. Up and over. Over once. And down. And over. Down and over. And over once. Up and over. Up and over. And over once. And down and over. Down and over. If you want, you could put a very simple bandage to kind of keep it closed just for the day. But just soap and water should be fine. Give them information about signs and symptoms of infection. Make sure that the patient knows that to return to the clinic in the next 10 days or so, just to make sure that the sutures are healing fine and to get the sutures removed by a doctor or a nurse practitioner. And that's it.